All right. Hi, folks. This is Shweta Palakode, and I am a social science analyst with the Substance Abuse and Mental Health Services Administration within the U.S. Department of Health and Human Services. Today, I'm going to give you an overview of the CCBHC Quality Measures Reporting Template. Next slide, please. Okay, so first I will tell you the intended audience for this webinar. Then I will go on to telling you more about the reporting template itself. Today I will do a walkthrough on the key elements of the reporting template and will share information on where you can find the template and also some additional resources related to the reporting template. Next slide. The intended audience for this webinar and thus the reporting template are existing and prospective CCBHC Section 223 demonstration state and clinic staff, CCBHC expansion grantee clinics, which include CCBHC PDIs and IAs, as well as SAMHSA GPOs. Next slide, please. Now I will tell you a little bit about the purpose of the reporting template, and we can move to the next slide. The quality measures reporting template was updated in 2024 to reflect the updated CCBHC quality measures and their specifications. The purpose of the 2024 reporting template is for states and clinics to report on their CCBHC quality measures data to SAMHSA. States and clinics should use the template beginning with measurement year 2025. Next slide, please. In the next couple of slides, I will tell you more about the timing and the method of template submissions for CCBHC demonstration states and clinics, as well as CCBHC grantees. For Section 223 demonstration program, the demonstration CCBHCs report clinic-collected measures using the reporting template to their demonstration states. States, in turn, report all required measures to SAMHSA, which includes the required measures that states collect, also called state-collected measures, as well as the clinic-collected measures. For example, for measurement year 2025, clinics will report their templates with clinic-collected measures data to the demo state per state directions by September 30th, 2026, and the state will report both the clinic-collected and the state-collected measures to SAMHSA no later than December 31st, 2026. States will submit the reporting templates to SAMHSA via a mailbox, and that is CCBHC measures submission at samhsa.hhs.gov. States will use separate templates for each clinic's quality measures results, including state clinic collected and state collected measures for that clinic. Next slide, please. SAMHSA CCBHC IAs and PDI grantees report only required clinic-collected measures using the template, and they report the measures directly to SAMHSA. For example, for measurement year 2025, CCBHC IAs and CCBHC PDIs will submit their completed templates to SAMHSA no later than December 31st, 2026. If the CCBHC is also part of the Section 223 demonstration, the CCBHC should adhere to the reporting requirements noted in the prior slide. For grantee reporting purposes, CCBHC IAs and PDIs submit the reporting template via a mechanism currently being developed, and that will be shared with the clinics by the end of 2024. Next slide, please. Okay, so next I will talk to you a little bit more about the structure of the reporting template. Next slide, please. The reporting template workbook is divided into the following sections as you see on this slide. The first two sheets in the workbook include the cover and instructions, and we call this the front matter of the workbook. Then CCBHCs have worksheets related to clinic-collected measures, which include a cover sheet for clinic-collected measures, a caseload characteristic sheet, and I will talk to you more about the caseload characteristic sheet in just a moment. Then there are worksheets where you can report data for each required quality measure. Next, clinics will have clinic collected optional cover page. Then worksheets where clinics can, if needed, report data for optional quality measures. The state collected measures are set up very similarly. States will have a cover sheet for state collected required measures. Further, states will have worksheets where states can report data for each required state collected measures. In addition, just like clinic collected measures, states will have a state collected optional cover page, then worksheets where states can report data for each optional quality measures should they decide to do so. And then towards the end of the workbook, states and clinics will see a roll-up report, which I'll speak to you more about. And lastly, the reporting template also has a back cover page. Next slide, please. Okay. The reporting template instructions page is where states and clinics will find information on how to use the template to report quality measures. In the instructions page, you will find information on the purpose of the template. It gives you insights on how the template is organized. It gives you guidance on navigating through some data-related issues, provides information on stratification of required as well as optional measures. And it also provides guidance on completing the caseload characteristics page. It also provides more instructions on how to complete certain sections in the measure templates. Next slide, please. As mentioned earlier, before each required and optional set of reporting templates, you will find cover sheets, which will ask information related to a state's name, CCBHC name, and CCBHC identifier. One thing I would like to note is that throughout the reporting template, you will find the term BHC used. Really, that just means CCBHCs. My understanding is that the term BHC was used in 2016, in the 2016 version of the reporting template, and that term just continued to stay on this reporting template as well. Next slide, please. In the next few slides, I'll give you more information on the caseload characteristics worksheet. Okay, so let's start with some basics. First, only Section 223 demonstration CCBHCs complete the caseload characteristics worksheet. You will see that the caseload characteristics worksheet includes the following categories: age, sex, gender identity, ethnicity, race, insurance status, veteran or military status, and total clinic population. Just want to note that when you click on a gray cell in any of the worksheets on these gray cells that you're seeing on this page, for example, you will get data entry instructions on what to enter in that respective cell. And that data entry instruction will be in this yellow text box like you're seeing in the screen. Next slide, please. Okay. First, the demonstration CCB8Cs will start by entering the total clinic population for a given measurement year, and you can see that in the screenshot, in the second screenshot on the screen. It's so in this example, let's say that the total clinic population for measurement year 2025 is 2,450. So then you will start reporting on the clinic population broken down into specific sociodemographic categories. In this slide, I've shown you how we group the clinic population by age category on the screenshot right above. So once you enter the total clinic population, and then you go on to adding the age or other categories, the percent will automatically get generated. And the percent is just informing us of the percent of total clinic population. In this case, we know that about 2% of the total clinic population were those of ages 0 to 11. Next slide, please. Okay, so regarding entering data in the sex category, the concept is the same. Just one thing I want to highlight on this section is that reporting on sex should be based on sex assigned at birth. Next slide, please. Okay, so reporting data based on gender identity is optional depending on what your instructions are from your individual state CCB8C demonstration program. Next slide, please. Okay, so here we have the caseload characteristics reporting based on ethnicity. The only thing I want to highlight on this slide is that if a client or a caregiver does not know the ethnicity or chooses not to respond, the client should be included in the unknown category. Okay, next slide. For race, it's the same concept on data reporting and nothing new to add here. We can move. Thank you. Okay. So for insurance status, you can choose a client's insurance status under the following categories: either Medicaid, CHIP, Medicare, dually eligible, which include Medicare and Medicaid, VHA or TRICARE, commercial insurance, uninsured, or enter another payer not listed here. One of the key points to note here is to choose the payer status at the first CCB8C visit in a measurement year. Next slide, please. For the veteran or military status section, there is no requirement to report on discharge status or eligibility for VA services. For the reporting template purposes, we are treating all individuals discharged from the military as veterans. And that's everything I have for the caseload characteristics template. Next slide, please. Now I will walk through other components within the CCB8C reporting template that will be applicable for CCB8C demonstration clinics and states, as well as CCB8C PDIs or CCB8C IA grantees. Next slide, please. Each state or clinic quality measures template will start with the measure title. In this screenshot, you will see that the measure title, which is the Screening for Depression and Follow-up Plan, also called the CDF measure. It's specific for adults here. And beneath that, in the next row, you will see information about the measure source or steward. Then you have section A that requires you to add the measurement year, where in the screenshot, it's the year 2025. Then you will select the data source, which is section B. you will see a drop-down menu on the very corner of the data source type cell that allows you to choose the type of data source. So in this example, let's say we choose medical records. And if you choose medical records, then in the cell next to it, you will choose the type of medical record. Is it an EHR, paper record, or both? If your data source is not listed in the drop-down menu, you will select Other, and then add what the other data source is in the cell below. And that would be entered in the screenshot in row 8. Then for section C, which is the date range for the measurement period, enter the start and end date for the data used for the denominator and numerator in the correct row. I will note that there are data validation constraints throughout the workbook. So if there are significant deviations in your data entry, Excel should automatically flag that. Next slide, please. Okay. Now let's talk about the performance measures section, which is section D in your templates. To begin with, this section provides a description of the measure. Then you have sections that require data reporting stratified by payer, ethnicity, and race. For more information on how to report the data based on these stratifications, please refer to the technical specifications and the template instructions near the beginning of the template workbook. I just want to note that some measures, such as the follow-up after emergency department visit for substance use, or the follow-up after hospitalization for mental illness, or even the initiation and engagement of substance use treatment measure episode or discharges rather than collecting data on clients. And the template is configured to collect data on episodes or discharges. Next slide, please. Section E asks whether you were able to adhere to the measure specification and if you've had any deviations from the measure specifications. Section F provides you an opportunity to add additional notes that you would like to convey on a given measure. More information about each of these sections is included in the template instructions and in the beginning chapters of the technical specifications. Next slide, please. The roll-up sheet is a good feature, which is towards the very end of the template. So this is a good feature that comes in handy for you because when you enter any stratified data in any quality measures worksheet, that data populates in the roll-up sheet. I could see a few different uses for the roll-up sheet, but one use of it is when you're getting ready to submit your template, you could review the roll-up sheet and see if all your stratified data from each quality measure is present in that roll-up sheet. So this sheet comes in handy for QC purposes, for having all the data for quality measures consolidated in one sheet. So in this slide, for example, you're seeing data populated in the roll-up sheet under the CDF 80 measures section. And that is because I entered data in the CDF 80 quality measure worksheet, and that data was just copied here as well. Next slide, please. So we are towards the end of our presentation. I want to spend some time talking about where you can find the reporting template and also some reminders and additional information related to the template. So the template is now posted on SAMHSA's CCB8C website. I've included the link to it in this slide. You will also find that the reporting template is under the 2024 data reporting template section. So So just to clarify, you go to this SAMHSA CCB8C website, and then you go to quality measures, and then under the 2024 data reporting template section, you will find this template. I already talked about this, but as a starting place, I would definitely encourage you to review the template instructions, which you can find in the second worksheet of the reporting template. And as another reminder, on each measure template, data entry guidance is provided when you click on gray cells in the template. Of course, needless to say, is that a key resource, as you all know, is the technical specification and resource manual. And if you go to section 2, within the resource manual, and then go to reporting and submission of measures section, then data reporting templates section, where you can find more information on on reporting on quality measures. But generally speaking, the technical specification includes a lot of detailed measure specification for reporting quality measures. Lastly, whether you're a state or a clinic, if you have any questions regarding quality measures reporting, please direct them to the email address on this screen, which is ccb8cmeasures@samhsa.hhs.gov. And finally, the slides and recording for today's presentation should be available on SAMHSA's CCB8C website. Next slide, please. Okay, I do have a few slides on here on copyright and licensure information and agreements, along with some acknowledgements for the quality measures stewards. You can feel free to read the fine print in detail when you review the slide deck. Next slide, please. Next slide. No, one more slide, please. And then one more. Thank you. All right, so we have reached the end of our presentation today. I will close today by thanking you very much for your time and attention, and I will see you at our next Quality Measures webinar.